Myself, Dr. Kular. I'm working as bariatric surgeon at Kular Hospital, Bija, Punjab, India. This is in the northwest part of India. We are doing mini gastric bypass from last about 8 years. Today we will discuss the diet after mini gastric bypass. Basically, what we say about mini gastric bypass is that it is a non-obstructive but restrictive procedure. Non-obstructive means that it allows you to eat. The gastric pouch is bigger and the outlet of the gastric pouch is big. The outlet of the gastric pouch is about 5 to 7 centimeters wide. So what we believe is there are two different kinds of you can say streams and two different kinds of mechanisms, two different kinds of thoughts for weight loss. One is obstructive and restrictive, like what we have with band. So band stays here, it is tight, it doesn't let you eat. So this is obstruction. But with MGB, you have a wide gastric tube and the outlet of the gastric tube is opening into the small intestine and the outlet is wide. It is not tight. It's about 5 to 7 centimeters. So what is happening is your food is going down. Whatever you eat, you can eat solids quickly after MGB because of the wide tube. What we do is on day one, like if your surgery has been done today, we can call it day one, or technically speaking, we call it day zero. On day zero, the day of surgery, we start you with water. You can take sips of water within a couple of hours of surgery. Generally, we do the surgery early in the morning and the patient is taking sips of water by the afternoon. And by the evening, the patient is walking. This is because the surgery is small, it takes about 30 minutes, it uses less amount of anesthesia, patient is out of bed quickly, and patient is taking liquids quickly because the tube is wide, the edema is less, there is no obstruction. And on day one, post-op, day one means surgery done today and we are talking about tomorrow, day after today, the next day of surgery. Patient is allowed semi-solid diet. Like what is common here in our Indian region is patient is allowed to take dal or some curd or yogurt or some paste kind of liquids. So these are allowed from day one. So this is slightly different from the other diets what we used to have with band or sleeve or Roux-en-Y, because those are all mainly restrictive procedures, and with a restrictive procedure patient had to be on liquid diet for about 6 weeks. That is about 1.5 months. But with mini gastric bypass, as the outlet is wide and the tube is wide, we start the patient on semi-solids on day one. And for 7 days from the surgery, patient is taking similar kind of semi-solid diet, and you have to take liquids minimum around 2 liters. Some patients do not take 2 liters. It's not that hard and fast, but still it should be nearing 2 liters. Maybe 1.5 liters is also good, but we recommend minimum 2 liters should be taken. And if you can take more than that, that's even better. You need to take more of salt. Mini gastric bypass pushes salt out of your body, and that is how it controls your blood pressure. So you need more of salt, more of liquids. Why more of liquids? Because it puts you into a dehydration kind of state. It's like giving diarrhea to a normal patient. Mini gastric bypass gets your extra water out of the body. So you need extra water for drinking. It can be water, it can be skimmed milk or some juice or some soup, whatever you like. It should be having less sweets, more of salt. So liquid, more salt, semi-solids for the first week. And another recommendation for the first week is that the patient should be eating quite frequently. Maybe every hour or every 2 hours, whenever you feel hungry, you should try to eat something. So it's just like you can imagine a 6-month-old baby. You have to eat frequently but in small volumes. And after the 7 days, patient comes back to us generally on the 8th day. So we take out the staples and do a barium contrast study to see the size of the pouch, size of the outlet, or any other technical problems. We just confirm on day 8. If everything goes well, then we would allow you to take complete solid diet after 8 days of surgery. So from day 8 onwards, you can take anything and everything. So that is the kind of luxury you can say with mini gastric bypass. You are allowed to take anything and everything from day 8. But anything doesn't mean any amount. You cannot eat too much. Generally, patients are able to eat in very small volumes. Maybe you can take one bowl of some vegetable or some pulses, some dal or khichdi, or maybe some patients can take half chapati. The idea is that you can take anything, but you have to chew well and go slow. That is the golden rule. You have to chew well and go slow, so that there should be no throwing out. If you go very fast, you eat too fast, too quick, then you can throw out, because this pouch is still much smaller than what it used to be earlier. Then the big gastric bag has been converted into a tube. Although it is bigger than what we have in Roux-en-Y or sleeve, but still you cannot eat that much, especially in the beginning. So what we see generally in the first 1 or 1.5 months, patient has to be careful. Do not try to eat too much, because your eyes and your mind will say, I can eat this, big plate full of vegetables or chicken, but you will not be. So you should not get frustrated. In the first couple of months, it's normal. Just try eating some healthy food. It could be a fruit or vegetable, or it could be chicken, some roasted chicken, some grilled chicken. You can start from day 8, but go slow, chew well. You might be able to take just 2 bites. Some patients can eat 2 leg pieces. Your capacity, your compliance of the bag, of the stomach tube, that is different. It varies from patient to patient, but you have to go slow and chew well. And keep on eating every 2 hours. Take more liquids, take more of salt. Generally, the patients are good. 99% of the patients should have no vomiting, no nausea after mini gastric bypass up to 2 months. After 2 months, I think most of the patients will be able to take a moderate amount of diet, which would mean that, like, if you are living here in the area of Punjab, you should be able to take at least 1 chapati, or maybe sometimes 1.5 chapati, with some vegetable and a bowl of dal and a bowl of curd or yogurt. So this is, we can say, a medium amount of food can be taken after about 2 months. So that you learn gradually. There is no hard and fast rule that you have to eat this much or that much. It depends on your tummy. You need to listen to your tummy, go slow. So gradually your diet will start increasing as the gastric pouch slightly dilates and the edema settles. So once you start eating a moderate amount of diet, then we do not recommend you to eat the same food every 2 hours, because that way you can end up eating 10 chapatis in a day. We don't recommend that. That will be binge eating. Then if you're taking a full meal, the good thing is that you should take the full meals about twice a day. The first meal should be at around 11 o'clock in the morning, and the evening, the dinner could be around 7 or 8 o'clock in the evening. Then what about the lunch? Generally, we recommend that we should not take full meal at lunch. With MGB, you need to take some small meals in between. Every 2 hours, you will feel hungry. So you should either take 1 or 2 bites of apple, maybe half apple or even full apple, whatever your stomach allows, or you can take some banana or some other fruit. Take a bowl of curd or yogurt or some glass of skimmed milk. So these are the choices. You need to look for some healthy choices in between the meals. So these kind of, you can say, snacking is very much required and necessary after MGB. Otherwise you might start feeling dizziness or some weakness, because your body needs something every 2 hours. And still, never forget about salt. You have to take extra salt after MGB because it's pushing the sodium out of your body. So even later on, maybe 8 months, 1 year, 2 years, more salt, more water, and small meals. But the big meal, full meal, should be only twice a day. We should not try to eat much of carbohydrates like chapatis or rice or other such things. And there is another important thing about the diet. We say MGB will give you the luxury to eat for once, but it will punish you for the wrong things which you have eaten. Like if you take some fried chicken or some butter chicken, you will feel bloating, some distension of the abdomen, gas formation. You will literally see the oil coming out of your stool the next morning. So that shows that you have taken a lot of oil a day before, and you will not be happy with that gas or bloating sensation. So we say MGB will punish you for small little wrong things, small little wrong eatings which you are doing. So you need to learn, you need to recognize. What we recommend is you keep a diary. Take a diary and just put on it, I have eaten this thing in the morning, I'm happy. Afternoon this, happy, not happy. So gradually, in a matter of 2-3 months, you will learn what things are good for you and which things are not good for your tummy. Like commonly we have seen, you can take 1 bowl of ice cream, but if you take 3-4 balls of ice cream in one go, you might not be comfortable after 15 to 20 minutes. This is called as dumping. You take a lot of carbohydrates or a lot of sugars, after 20 minutes your sugar will start going down, because MGB is against the sugars. If you take a lot of sugars, it will send signals to your pancreas to produce more insulin, and in turn your sugar can go down. So this is called as rebound hypoglycemia or late dumping. With this, you will feel dizzy, weak, palpitations, you will have sweating. You will not like this feelings, but you must know why is this happening. You should be able to correlate it with what you have eaten. So you must maintain a diary for the first 2-3 months. You will get to know this is bad, this is good, bad, good. So then you can have a choice of foods for yourself. And what we say is that mini gastric bypass will get you towards a Mediterranean kind of diet, which we consider is the healthiest and the best available diet. So that is called as behavioral change. Earlier we were talking about behavioral changes after a band or sleeve, but we have seen that restrictive techniques which stop you from eating. Your mind wants to eat, but the restriction has stopped you. Then you try other different things. You try ice cream, you try Coke, that you can take. So that's how the highly restrictive techniques take you towards wrong kind of diet. We call it as low calorie, soft calorie failure, which is not good. But with MGB, we have generally seen 95% of the patients do not like the soft calories, like Coke or other sodas or ice cream. Small amount is good, but too much you will have dumping. So that's what I have seen. This is how the mini gastric bypass controls. It does not stop you from eating for the first time. You can eat, but after some time it will punish you slightly, it will poke you slightly. So you need to recognize that what's happening. And the time you start recognizing, you are always happy. Every day is good. Whenever you feel low, you need more sodium, put some salt in water or have some soup or skimmed milk with salt. You will feel good within minutes. So that's a kind of test that you need more of sodium. What other things can go wrong in the first months when you start the diet? Some patient can have vomiting, but this generally we expect in only 1 to 2 patients out of 100. 98 patients out of 100 should have no vomiting at all. So if you are having vomiting every day, you need to report back to us. That means something is not normal. So we need to have a look, or we need to review your case, what's the trouble, or you might be eating too fast or something like that. Normally we do not expect any kind of weakness after surgery. If you are feeling any weakness, that means either you are dehydrated, you need more liquids, you need more salt, or you're not eating properly. You need to eat every 2 hours. Small little things like groundnut or some almonds, some fruit or some vegetable every 2 hours, little amount every 2 hours with some salt. Then you should not feel weak. And some exercises also allowed. That should happen from day 1. Patient is allowed to go for a long walk. You can go for 30 minutes, 40 minutes walk. And after 10 days, you can start jogging or running or doing a treadmill or ellipticals. And after a month, you can start with full exercises in the gym. So that is all about the general instructions about diet after the mini gastric bypass. So we will come back with other problems and solutions and how to handle the mini gastric bypass in the following videos. Thank you very much.